Hey guys, this is Maria Suarez at Balance Physical Therapy at our Quickbridge location. Today I'm going to go over some cervical techniques that I use almost every day or at least every week to assess the cervical spine with a little bit of treatment. So just letting you guys in with a little bit more of what we would do on the first day. So one of the most common diagnoses we get is cervical pain. So a lot of patients have a lot of trouble looking to the right or looking over their shoulder, looking up, looking down. Or they have a lot of symptoms down their arms, so pain, numbness, or tingling down the arms. So what I would do on day one is, one of the things is to assess and try to rule out hypomobility, which is just stiffness within the spine. So I have a model here, and what I would do is, one of the most basic techniques that I would do is look at this spinous process, which is this pointy part of your spine. And I'm essentially pressing this back that way, and I'm trying to see if there's any stiffness within each segment or the intervertebral spaces. So this is important because the nerves come out of the space between the two vertebrae. So part of my assessment is to see if there's stiffness that's causing maybe some impingement or narrowing in this space where the nerve comes out. And then my treatment approach would be to mobilize this segment in and out, or to get right in this gutter and press that back, and that's going to open up. It's gonna be exaggerated, but it wiggles and it opens up a little bit of space right through here. So let's go over how I would do that. All right, so in this one, what I'm gonna do is we're gonna do the CPA, which is a central posterior to anterior, which is from the back to the front. And I'm checking to see, or to roll out that stiffness. So I get right on the spinous process, right on the middle of the spine. And then I start pressing down with my thumbs up until I reach resistance or until the patient has pain. Now, if Miriam were to have pain, I would ask her what happens when I back off. Is she having pain still, or did the pain resolve after I backed off? If the pain goes away, that tells me her symptoms are, she has low irritability. I'm gonna wanna push into that pain a little bit to get rid of the stiffness. But if she has pain, even after I take the pressure off, she has higher irritability, and I'm gonna be a little bit softer, and we're gonna focus more on pain relief. So I can use that then as my treatment and stay there. So if she has low irritability, I'm gonna push into the resistance. Even if it hurts a little bit, I'm gonna remind her that I'm pretty confident that when I back off, the pain's gonna go away. So I'm able to push a little bit more. Now from here, I decide, do I want to go in an oscillating motion, or do I want to go into the resistance, all the way out of the resistance? And that's just based on what I feel that day for the patient. So then I can then do a unilateral PA, which is very helpful for anyone who's suffering from symptoms down the arm. So any radicular symptoms, numbness, tingling, or pain down one side of the arm. Whereas with central, it's if the patient has bilateral symptoms or symptoms down both of the arms, or anything just centrally, like middle of the body. So the UPA, I'm right in the middle again, but I'm coming off maybe about a thumb's width to the side. And again, I'm gonna assess first, and I'm going all the way down. Same thing until I reach resistance, or until the patient tells me there's pain. I get my depth, and then from then on, again, I'm getting her irritability. She's gonna tell me, that hurts. What happens when I back out? Is that painful, or did the pain go away? And then from there, I can again just go in and out of the resistance, or go into resistance and wiggle there a little bit. And again, the goal is to get rid of stiffness and hypomobility. And hopefully that creates a little more space for the nerve to breathe and get rid of some of that symptoms down the arm. All right, guys, if you like what you see, please subscribe down below and give us a like on Instagram. Have a nice rest of your day.